Assalamualaikum and hi everyone. In this video, we are going to talk about a genetic disorder which is called sickle cell anemia. Have you ever stumbled upon the term? For your information, sickle cell anemia is a genetic red blood cell disorder that affects the hemoglobin in the red blood cells. So how does this happen? Sickle cell anemia is caused by a mutation in the DNA strands that will affect the hemoglobin. The hemoglobin in people with sickle cell anemia becomes defective and causes the red blood cells to change shape. The normal hemoglobin, called hemoglobin A, will be replaced by the defective hemoglobin, which is known as hemoglobin S. In over time, the red blood cells will become rigid and shaped like crescent moon or sickles. When the sickle-shaped red blood cells get trapped in the spleen, they will be destroyed. As the body cannot replace the lost cells fast enough, the body will then have too few red blood cells to carry oxygen throughout the body, and this condition is known as anemia. In normal condition, red blood cells are round, disc-shaped and flexible. They can move and carry oxygen easily, even through the smallest vessels in the body. However, in sickle cell anemia, the red blood cells will become rigid, sticky and will clog the blood vessels, and this will reduce or cut off oxygen to tissues and organs in the body. The symptoms for sickle cell anemia are commonly appear around 5 months of age, but they may vary from person to person and change over time. The symptoms may include anemia, where the body will have a low level of healthy red blood cells, episodes of pain that can last a few hours to a few days, dactylitis, which is a severe swelling of hands and feet, frequent infections, delayed growth or puberty in children, and also vision problems.
Next, for the treatment, aims of managing sickle cell anemia are to avoid pain episodes, lessen symptoms, and block complications. In this case, it can be treated by consuming medications such as hydroxyurea, crizanlizumab, and L-glutamine oral powder. In this video, we are going to focus on hydroxyurea and crizanlizumab only. The first medication is hydroxyurea. It is also known as Cyclos, Droxia, and Hydrea. It is classified into anti-neoplastic class of drug. It is given at the initial dose of 15 mg per kilogram per day as a single dose and at the maximum dose of 35 mg per kilogram per day. Its mechanism of action includes increasing water content and deformability of sickle cell, which later alter the adhesion of red blood cell to the endothelium. Consequently, this reduces both pain crisis frequency and the need of blood transfusion. Moreover, hydroxyurea is administered orally by swallowing the whole tablet with a glass of water. Nevertheless, it may also bring the adverse effect of infections and neutropenia. This drug is classified in the pregnancy category, which means pregnant mother is advised to avoid this medication. Besides, medication that can be used to treat sickle cell anemia is crizanlizumab, which is also known as Adakveo. Classified in p-selectin inhibitor, it is administered 5 mg per kilogram. It works by binding to p-selectin, which then block interaction with p-selectin glycoprotein ligand 1. When all is done, platelet aggregation can be inhibited, thus maintain normal flow of blood and reduces pain crisis. This medication is also given intravenously and may bring out the adverse effect of nausea and back pain. Lastly, crizanlizumab pregnancy category use is still not announced. In addition, surgical and other procedures such as blood transfusion and stem cell transplant can also be opted to treat sickle cell anemia. In blood transfusion, donated blood is inserted intravenously into the patient of sickle cell anemia. This will increase the number of normal red blood cells, thus help to reduce complications and symptoms often caused by lack of normal red blood cells. Consequently, this raises the question of the curability of sickle cell anemia. Yes, sickle cell anemia is curable. To start off, this involves bone marrow, site of blood stem cell production. Every day, billions of blood cells are produced as they constantly divide and mature into different types of blood cells and replace the worn-out cells. In this case, person with sickle cell anemia has damaged stem cell. The procedure includes finding matched donor, such as siblings. Then, patient will go through conditioning treatment in which high doses of chemotherapy is inserted before the transplant. Next, affected bone marrow is replaced and patient will then go through engraftment phase. During this phase, newly replaced stem cells will infuse into the bloodstream and bone marrow, which later form new and healthy blood cells such as red blood cells, white blood cells, and platelets.
Since it is a genetic disorder, how is it inherited? Sickle cell anemia is an autosomal recessive disorder. This means that for the disease to develop, 2 copies of an abnormal gene must present. If only one abnormal gene is present, this means that the person is a carrier. The following figures show the probability of children to have sickle cell disease based on their parents' condition. When both parents have sickle cell disease, all of their children will have sickle cell disease too. When one parent has sickle cell disease and another has the sickle cell trait, the risk of their children to have sickle cell disease and sickle cell trait is 50-50. When both parents have sickle cell trait, the risk of their children to have sickle cell disease is only 25%. When one parent has the sickle cell trait while another is unaffected, the risk of their children to have sickle cell disease is 0%, but there is 50% risk of being a carrier.
How does the mutation happen?
Mutation that cause sickle cell disease happen on hemoglobin beta found in chromosome 11. A single code letter change in the DNA and alter one of amino acid in hemoglobin protein. In the sickle hemoglobin, valine take the place of glutamic acid. How does the hemoglobin become sickle shape? Hemoglobin become deoxygenated after delivering oxygen to the cell in body tissue. The abnormal hemoglobin S gene can cause rigid, non-liquid protein strands to form within the red blood cell with less oxygen. The red blood cell becomes sickle shape. How common is this disease? Approximately 1 in every 250,000 babies is born with sickle cell disease annually around the world. It is the most common inherited blood disorder in United States. This disease is most common among people whose ancestors come from India, Africa, Saudi Arabia, Mediterranean countries, and Spanish-speaking regions in the Western Hemisphere. Did you know sickle cell disease is more common among people in countries where malaria is or was prevalent? People who inherit the sickle cell gene are assumed to be less likely to have serious types of malaria. How many people have sickle cell disease? It is estimated that 100,000 Americans have sickle cell disease. Approximately 1 in every 365 Black or African American newborns have sickle cell disease. Sickle cell disease occurs in about 1 of every 16,300 Hispanic American births. About 1 in 13 Black or African American is born as a carrier.
Common race affected with sickle cell anemia include, firstly, people of African descent, including African Americans, among whom 1 in 12 carries a sickle cell gene. Secondly, Hispanic Americans from Central and South America. The last common race affected with sickle cell anemia are the people of Middle Eastern, Asian, Indian, and Mediterranean descent. Are there any relationship between sickle cell anemia and gender? Eventually, there is no gender or sex predilection exists since sickle cell anemia is not an X-linked disease.
Moving on to the next question. How long is the average lifespan of a sickle cell disease patient? An average lifespan of a sickle cell disease patient was 54 years old compared to a non-sickle cell disease patient which is 76 years old. Meanwhile, if they live in a quality-adjusted life expectancy, the patient may live up to 33 years old compared to a non-sickle cell disease patient which is at 67 years old. Moreover, factors such as acute and chronic conditions like renal insufficiency, acute anemic episodes, and seizures variously affects a patient mortality. Other than that, death among patients under the age of 20 were mainly caused by pneumococcal sepsis. For infants and children, there are processes like interventions, newborn screening, immunizations, and use of prophylactic antibiotics to prevent infections that helps reducing their mortality rate. The next question is, how is the family of a person with this disorder affected? By having a chronically ill children may affect the family establishment and parental health related quality of life. First point is how parents are affected. The parents' physical health and emotional well-being may deteriorate, and a waning in parents' marital relationship as one of them have been over-involved in fulfilling the child's need, while the other who had to work overtime in order to pay for the medical bills of their child's illness. They also may express hopelessness and feeling frustrated as their child experiences a painful episode. Lastly, they may feel overwhelmed from their child's sickness. Second point is the effects on parents and child relationship. A single parent is the most affected when having a child or a family member with a sickle cell disease. This is because the burden carried by a single parent household is larger than a two-parent families, and this is detrimental in parent-child relationship. The parents also need to take care of the child's need, like medical treatment and paying their bills, while making ends meet, and is taking quite a burden in a single parent family. By having a chronically ill children, it may cause a sense of overprotectiveness within parents towards the child, and this limits the child activity as they are prohibited from being active and less independent than they're capable of being. The last point is how the effects on the healthy siblings. The healthy siblings may be left aside without notice with their friends and relatives, while any family events are cancelled or shortened. This can cause the healthy sibling to feel being left out from their parents' love. Besides that, they may also experience resentment on the restrictions caused by the ill siblings, mainly if the sibling did not understand of why the cause of these restrictions. Later, it may change into a sense of jealousy or guilt. Lastly, the siblings of a sickle cell patient may show an increase in behavioral and emotional problems. For example, they may show negative behavior during the first year of the ill sibling's diagnosis. Furthermore, they may exhibit a higher anxiety levels and show a shallow self-concepts than their ill siblings.
Important learning outcome that we can achieve from researching this disease include, firstly, sickle cell disease is the most common genetic blood disorder. It is a genetic condition that occurs when a child receives a sickle cell trait from each parent. It affects millions of people worldwide and is most common in African, Mediterranean, and Arabian Peninsula areas. Second important learning outcome, which is this disease affects many races and not just African Americans. While sickle cell disease is more common in African Americans, it is still present in other racial populations. Thirdly, we can help the patient affected with this disease by becoming a blood or bone marrow donor. It is because patients with sickle cell disease occasionally need blood transfusions, and the only proven cure for sickle cell disease is bone marrow transplant. Last but not least, the important learning outcome that we can obtain from researching this disease is sickle cell disease is a lifelong illness, but there are many effective treatments that can reduce symptoms and prolong life of the patients affected with this disease.
This is a poster on 5 facts about sickle cell anemia that we should know from CDC, which is Center for Disease Control and Prevention from America.
All in all, thank you for watching.